People spend hundreds, if not thousands of dollars on treatments for brain fog that do not work. As of 2025, no matter what anyone says, there's no magical cure for this devastating symptom. In this video, I will tell you exactly what brain fog is and the 6-step framework that I use for my patients to help reduce or clear brain fog. Hi, I'm Dr. Karthik Udayappan, and I empathize a lot with patients that have symptoms like brain fog that are not well understood currently by the science of medicine. I'll be honest, in medical school, I never heard of the term brain fog. But in the last several years, especially after COVID, this symptom has become very common and frustrating in my clinic. Typically, patients want to jump in and talk directly about supplements. I personally have a nuanced take on this, so stick around until the end for that. So what is brain fog? When a patient says, "Doc, it feels like my head is in a haze, I can't focus, I can't track conversations, and I'm forgetting simple things," that is brain fog. The interesting thing is that when you put these patients through a psychometric test, they actually do pretty well. Brain fog is not dementia. It's a subjective feeling of mental fatigue or decrease in processing ability or poor concentration. It shows up often in conditions like long COVID or chronic fatigue syndrome, but it can also be seen in conditions like fibromyalgia or postural tachycardia syndrome, which is POTS. So let's jump right into the framework. Step 1 is ruling out mimics of brain fog. Sometimes brain fog is not brain fog at all. It's actually ADHD or a concussion with symptoms that are lasting for much longer than they should, or even chemotherapy-related cognitive issues, what a lot of people call chemo brain. These conditions require different specialists and different treatments. Step 2 is reviewing all of the medications that you're taking because there are many common medications that can interfere with cognitive function. These could be your anxiety medications, your sleeping aids, your bladder medications, your allergy medications, muscle relaxants. So it's always wise to go through your list of medications with the doctor and figure out if one of them is a culprit, and if so, asking your doctor for an alternate. Step 3 is looking for other medical conditions that could be causing brain fog. I'll never forget one patient I had. He was an executive at a publicly traded company, and he'd been noticing that his performance at work had been slipping and that the board was getting ready to fire him. He was also experiencing some fatigue and bloating, and he came to the conclusion on his own that he might have celiac disease. I agreed with him and I tested him for it, and indeed he had celiac disease. After he went gluten-free, his brain fog cleared. This story is a prime example of why we have to continually look for other underlying or adjacent medical causes like vitamin deficiencies like B12 or vitamin D deficiency, autoimmune conditions like lupus, also looking at sleeping issues like obstructive sleep apnea, hormone imbalances like thyroid or cortisol levels, other GI conditions like IBS or celiac disease. Step 4 is dialing in the basics, the unglamorous stuff. Making sure that you have a healthy sleep routine, sleeping at the same time every night, getting an adequate amount of sleep, making sure that your stress is under control, making sure that you're eating whole foods and not processed foods, and also making sure that you're getting regular physical exercise. A cautionary note here is for patients with chronic fatigue syndrome. Sometimes too much exercise can actually worsen symptoms, so exercise therapy actually has to be individualized. Step 5 is now when we consider treatments that are more trial and error. There is no gold standard treatment yet for brain fog, but this is the type of things that patients often gravitate towards. We don't fully understand what long COVID is and what are the exact causes of brain fog, and that is why we don't have a unified evidence-based treatment. People respond differently to different treatments. So I'll go through a couple just to give you a sampling. The first one is something called cognitive training or cognitive rehabilitation. Think of this as physical therapy for the brain. It could be computerized programs that guide you through exercises to improve your attention, your problem-solving ability, and your memory. There are many apps out there that can do this. Biofeedback is another unique treatment. This is when you are hooked up to a bunch of sensors like your breathing rate, your heart rate, and even your brain waves, and you're actually able to see those in real time. And a physical therapist actually guides you through trying to exert control over these processes. And this is a way to decrease fatigue and potentially improve your focusing ability. Another one is called vagal nerve stimulation. The vagus nerve is a large nerve in your brain that innervates your heart and a lot of your gut. And it's thought that controlling this nerve and increasing the stimulation of this nerve could lead to more relaxation and better focus. And so there are devices that can stimulate the vagus nerve in the neck, for example. Another option is cognitive behavioral therapy, or CBT. This is not just talk therapy. This is a therapy to address the thoughts and emotions that can actually worsen brain fog and fatigue. And lastly, let's talk about medications and supplements. Again, there is not a gold standard treatment. Some work better for others, and it's worthwhile trialing. I'll rattle off a couple medications and supplements here. We'll leave them up on the screen for you to reference and to talk to your doctor about. Some medications could include low-dose naltrexone, aripiprazole, guanfacine, N-acetylcysteine, palmitoyl ethanolamide, luteolin, various forms of magnesium, creatine, omega-3 acids, things like that. There's probably much more, but I am very cautious when I recommend supplements. I never do it willy-nilly. The reason is that the supplement industry is unregulated in the US. They are not FDA approved. Companies that sell supplements don't have to prove that their product actually works. And the safety is not really tested either. It's very wise to talk to your doctor about this so that you can trial these medications and supplements. Step 6 is experimental therapies. These therapies are not ready for prime time. I'm talking about things like hyperbaric oxygen treatment. They are used for other conditions, like, for example, wound healing, but there is some evidence that maybe it could be useful to treat brain fog. Same thing with brain stimulation, like transcranial magnetic stimulation. This is actually already being used to treat depression, and maybe it can work for brain fog, but I would not spend thousands of dollars on these treatments. I would look for academic medical centers near you that are potentially conducting clinical trials, and you enrolling in those trials so that you can have access to these treatments. So there you have it. That's my bird's eye view from 20,000 feet of the 6 steps that I walk through with my patients that have brain fog. So let's recap here. Step 1 is ruling out mimics of brain fog like ADHD. Step 2 is reviewing all of the medications that you're taking, making sure that one or a couple are not contributing to brain fog. Step 3 is checking for underlying medical conditions that could be worsening brain fog. We'll leave a list of medical conditions there, and that could be a conversation starter to share with your doctor. Step 4 is really optimizing your lifestyle in terms of sleep, diet, stress reduction, and regular physical activity. These can tremendously help brain fog. Step 5 is trying things that have a little bit of evidence, like certain medications and supplements. Again, you'll have access to this. We'll leave this on the screen and you can peruse this and talk with your doctor about. Step 6 is the experimental treatments like hyperbaric oxygen and transcranial magnetic stimulation. Again, these are highly experimental. I would not spend thousands of dollars on these treatments unless you're able to access them through some clinical trials. If there is a particular area that you want to hear more about, like supplements or cognitive rehabilitation, I'm happy to go more in depth about it. Just drop a comment below.